Peyronie's disease is a condition that is not related to cancer, but it's an inflammatory scar which develops within a man's penis in the erectile tissue, and that can lead to a number of consequences, such as erectile difficulties or a bend in the penis, which we call is a chordee. And the bend in the penis can lead to difficulties with sexual function, and Peyronie's disease is a benign or non-cancerous condition that occurs more commonly in between the 35 to 50 years age group. Generally speaking, it's a condition that arises completely out of the blue or spontaneously, but men would present with a discomfort or pain on erections to start off with, and the condition may evolve over a number of months to either have resolution or relief of the pain just spontaneously, or development of erection difficulties, or potentially a bend in the penis. But initially it's a pain, it's a small nodular area or a lump in the penis, and an associated bend or reduction in quality of the erections. The cause of Peyronie's disease is unknown, or why it happens, but the actual tissue that you can feel as a lump is scar tissue, and that scar tissue causes the penis not to be able to stretch as well. And this type of scar tissue can occur in other parts of the body, so you can have an overreaction to a skin scar or a keloid. You can have a bend in the small and index ring finger where you get what we call Dupuytren's contractures, and those two conditions are associated with an overgrowth of scar tissue, and it's probably a reaction of the body to microscopic or small trauma, which subsequently leads to an over deposition or laying down of scar tissue, which then affects the function of the penis. The cause is unknown, but there's no question that if you have a propensity, or if you actually have more scar tissue yourself, and if Dupuytren's runs in the family, there is a greater risk of Peyronie's occurring. But it's not something that we know a genetic link of, and it's not something we recognise as a significantly greater risk running within families. I mean, one of the difficulties with this type of condition is it's something that can be both embarrassing and difficult to understand. There's no obvious cause for it, and it can lead to a difficulty in both sexual function and body image. And so a lot of men delay presentation, and a lot of men don't come forward for assessment and treatment because both of embarrassment and no knowledge. And a lot of the times, because information is not easy to find about it, it's an unusual name of the condition, and in general people are usually quite late in presenting. So I suppose it's something, because of the nature of the condition, the cause of what happens, it's something that men generally are not early in presenting. However, on the flip side of that, early presentation will just mean some degree of peace of mind. It doesn't change our treatment options because, again, the cause is not known and there's not good early treatment other than to wait for the resolution of the inflammation, reduction of the pain, and then to treat the scarring which occurs with Peyronie's. So one of the important aspects is that we don't offer any acute treatment that seems to make any difference to the long term. What we can do is offer what's going on, what's the natural history, what's likely to occur, and then what are the different management options down the track. So you can offer some potential clarification of the situation, and that for a lot of people is as important as actually treating something and dealing with it at the time. The important aspects of Peyronie's disease is that there are different phases of the condition. There's the initial phase, which involves discomfort, a nodule or a lump, and there is no treatment we would specifically offer to resolve that scar tissue. There's lots of things that are described. There's creams, there's medication, but nothing seems to actually make a difference to the natural history of what is an acute inflammation that then has to settle down. So generally we offer a diagnosis, a management plan, and we follow patients up in an interval of time. And patients will either end up with a normal erectile function and maybe a small scar, a bend in the penis, which might affect the ability to have sexual intercourse, but the erections may be still quite good, or they may end up with significant erectile difficulties if the scarring actually involves the erectile tissue or is a greater amount of scar tissue. But we don't offer any acute treatment through that. What we do is indicate to patients that it will resolve in time. There are treatments in the acute phase that are being researched, different creams, vitamin E's. There is also treatment in the phase where there is a bend in the penis. There have been some research studies looking at lithotripsy, which is an attempt shockwave treatment, which is using sound waves or ultrasound to try and break the scar. And there are treatments that look at injecting material into the scar to soften the scar. And on the basis of natural healing, there will be some degree of reduction of scar tissue, stretching of the erectile tissue, and resolving the bend over time. Those treatments are not effectively proven yet for Peyronie's disease, but there is certainly ongoing research work about that at the moment. There are two aspects to that. One is if men have a problem, they need to understand that in a research study, the outcomes of treatment are not known. To be involved in a research study is a voluntary response based on an understanding of what the treatment options are, and secondarily, that the follow-up will be a little bit more structured, because in a research study one has to know that everyone goes into the research study with similar situation and there's a standardised way of assessment. So in a research study it's important to be aware that you'll be followed a little more intensely, but in general the outcomes are not known, and there are benefits in some of those situations and there are sometimes some downsides which are just prolonged assessment. Alternative treatments may be surgical, so an operation can be undertaken as an alternative, and that's standard treatment. So prior to considering a research study, it's important for men to understand their alternatives, to understand all the information about a study, and to go into that voluntarily. But we would certainly encourage it, because currently there are no non-surgical treatments that are effective for Peyronie's disease. And if there are any studies being undertaken where non-surgical options are being assessed, that's the only way we're going to know if there is any improvement available in the management of Peyronie's disease. In New Zealand, for a patient to see a specialist, they recommend it to be referred through their GP. So for a man who has a concern, we would normally recommend assessment through their GP and subsequently referral if the GP thinks that's appropriate. Nowadays, in the modern information era, the internet is some of the best sites available for information, and the problem with that is there can be some very good information and some very inaccurate information out there. There's no question that Peyronie's disease has some very good websites available which will give you information on the condition, the assessment, the management options, and also any research studies that are being undertaken, so that men can make themselves available of that information. And the advantages of that is you can do that at your own time in your own private environment. So I think a lot of people nowadays are finding out information prior to coming and seeing anyone, and certainly with Peyronie's there's a lot of information that is out there that is relevant. One of the things I would say is that patients with this condition do delay presentation because of embarrassment, and the more information patients can find out prior to coming along, the more understanding they have in a discussion setting, because they've already got on board some of the material that we're going to be talking about. The second thing is that there's no question that clinical studies are useful to improve treatment, both for the patients in the studies, but also for patients in the future. So there are benefits in being involved in the study, and patients also feel good in themselves if they're doing something that are helping other people. So I suppose from our perspective, there's a number of benefits just outside the information for that individual person. What I would advise patients to do is, firstly, don't ignore the problem. Secondarily, there is treatment that is effective. There are surgical options and there are non-surgical options and clinical studies. So what we want to do is make sure patients are aware of this and know where to go to access management.